We're in a very difficult time, and we're going to have to do the kinds of restrictions of things we would like to have done, particularly in this holiday season, because we're entering into what's really a precarious situation, because we're in the middle of a steep slope. You know, when I tell what people need to do, we say it over and over again. We know it works, but also that there is, as I mentioned to you before, Chuck, there is light at the end of the tunnel, because we will really be seeing vaccines soon.
President-elect Biden, who made the point, there's a big difference between vaccines and vaccinations. And we're looking now at the reality that when we were testing 1,200 people a day, that was a major undertaking. To get the vaccinations out, we're going to have to vaccinate 5,000 a day just in Detroit. And this country is not yet geared up. And so to me, people saying vaccines are coming, are coming, we haven't begun as a country to address what it's going to take to actually inject people with the vaccine.
4 in 10 Americans, though, told Gallup this month that they don't want to take the vaccine. That includes a majority of non-white Americans. So how are you going to convince Americans to take this vaccine?
So I want to make sure that all Americans know that these vaccines have been tested in tens of thousands of individuals. There are independent data safety monitoring boards. There's going to be an independent, transparent review. The Pfizer vaccine will have an advisory committee on December 10th. All the data will be out there. The Surgeon General and myself and all the team are really out trying to educate the public. We have to see what the data show, but all indications are this is an extremely safe vaccine, the Pfizer vaccine and Moderna.
It's going to get worse over the next several weeks, but the actions that we take in the next several days will determine how bad it is or whether or not we continue to flatten our curve. And right before Thanksgiving, we actually saw cases start to plateau in many states that have been aggressively mitigating. And as I mentioned, there are steps you can take right now. But I also want people to know there's hope. We are mere weeks away from starting to vaccinate the vulnerable, and we can significantly protect people who are at risk for this virus. So hang on just a little bit longer. If you're part of the public, I want you to understand it'll probably be end of first quarter, beginning of second quarter next year before you can get a vaccine. But you can go to coronaviruspreventionnetwork.org, sign up for a study, and you could get a vaccine in just a few days to weeks if you sign up for a study.
I got a couple of calls from colleagues and associates who were very much involved in different states throughout the country saying, we're at that point where we soon, if things don't turn around quickly, we're going to have a situation with capacity, not only of hospital capacity, but staff. You know, what do you think we should do? I mean, almost pleading for advice about, you know, what can we do? We don't want to lock down completely, but we might have to. If this, and I'm talking locally, I'm not talking about nationally. I'm talking about individual locations of people starting to see significant stresses on the hospital and healthcare delivery system.